Alan Hunt. Thank you everyone for coming. I was on the planning committee and helped put this together. Thank you everyone who was involved in that. This first panel is Goals and Approaches for Nutrition Incentive Programs. The main goal of the panel is to show that nutrition incentive projects have started for different reasons, but yet they do address common challenges. Part of the variation comes from each community having different issues and priorities on the ground because there are different local needs and there's also different local assets. A second goal of this panel is showing that nutrition incentive programs overlap in their goals with other activities and that they're trying to address multiple goals simultaneously. Sometimes that's done by design and sometimes that's done by need. This panel is focused a bit more on the whys, the goals and motivations of why these programs started. It's not as much focused on the how. The nuts and bolts session that follows this will address that more. The panelists were asked to respond to 3 different questions, and that was why their programs started, what are the basics of the program approach, and one thing that they would do differently, and that was probably one thing difficult to ask people to focus on. As Diane mentioned, panelists have about 10 minutes each to talk. They have 5 slides. We're not going to take questions during their presentations, so we're hoping at the end of the session that there'll be about 15-20 minutes for questions. I'm going to introduce everyone at this point, and they'll just come up and do their presentations as they each finish. I wanted to introduce Pam Hess, who will be our first speaker. She's the Executive Director of the Arcadia Center for Sustainable Food and Agriculture here in Washington, D.C. They're dedicated to creating a more equitable, sustainable local food system, and they work in 3 main areas: sustainable agriculture and training and production, farm and nutrition education, and food access. Second, we'll have Martin Bork. He's the Executive Director of the Ecology Center in Berkeley, California. And the Ecology Center's mission is to inspire and build a healthy, sustainable, and just future for the East Bay in California. Martin has a master's degree from the University of California, Berkeley, and has focused his career on building scalable, community-based solutions that solve both social and environmental problems. Third, we have Nadia Delgado. Nadia works with farmers markets at the Food Resource Center at the Community Food Bank of Southern Arizona. The food bank in Tucson, aside from excelling at traditional emergency food relief, has an innovative resource center that focuses on food security, food justice, and approaches hunger and poverty through community-based action and fighting the root causes of hunger. Nadia is a native of the Southwest. Her family has farmed for generations, and her desire is to help bring the community back together and heal lives there. And Danielle Berman is a social scientist and research analyst at the SNAP Research and Analysis Division of the Office of Policy Support at USDA Food and Nutrition Service. She has a PhD in sociology from the University of Wisconsin-Madison, and she's also the project officer for the Healthy Incentive Pilots. So thank you, everyone. And Pam? I think you do right here.
Okay. Let's do a quick experiment. Right. Okay. Technology is scary. I'm Pam Hess. I'm the executive director of Arcadia. We're here in town. We have a small farm down on the grounds of a historic plantation that used to belong to George Washington. But most of our work happens here in Washington because this is where so much poverty is concentrated. A brief word about me. I come to the nonprofit world actually from journalism. I was a national security correspondent for AP and for UPI. I consequently spent a lot of time in the Iraq and Afghan wars, and consequently spent a lot of time at Walter Reed visiting folks I knew who had gotten hurt. And as you know, the signature injury of that war is an amputation, often lower limb. So when I started working with Arcadia and I went out on our mobile market, I saw a lot of people in wheelchairs, and my first assumption was, wow, war veteran. And as you all know, that's not the case. I quickly learned that these were victims of diabetes, a completely avoidable situation, and it's a grievous wound that we inflict on ourselves from our food system. Arcadia was started because there are two food systems in this country, and it's particularly evident in Washington, D.C. All of us in this room, the folks that live in this neighborhood, can get anything they want, especially on a Sunday morning. Our farmers market is incredible. But there's a whole other side of the city that is mostly reliant on convenience foods. They're cheap, they're ever-present, and they're shelf-stable, and they taste great. They're organized to taste great. As he said, Arcadia works in 3 areas, and these are 3 areas that are interlinked. We grow food, we train people to grow food sustainably. That food we use as a teaching laboratory for children and families to come learn about sustainable agriculture and how it differs from conventional and health effects thereof, and also nutrition. But finally, we harvest that food and we aggregate it with food from other local farms because we feel strongly that we need to support our farm economy. And we load it onto a mobile market. Our mobile market is a school bus that we rip the seats out of, jerry-rigged some deep freezers into thinking that they're refrigerators, loaded it up with crates, and we make 10 regular weekly stops in low food access neighborhoods in DC, and there's one in Northern Virginia. We go to places where there is not a grocery store, where there is not a farmer's market, where there's heavy use of SNAP, WIC, and senior farmers market nutrition vouchers, and where folks don't have cars, so it's very hard for them to get out to the grocery stores. Something you might want to know about DC, about 75% of our population shops for groceries outside the city limits. So imagine what's left for people within if they don't have a lot of resources. I want to run some numbers by you. We're a little bit small and adorable, but I think on the verge of being important when you see what we've done. With our one bus, and we're adding a box truck this summer, so we'll be going up to 18 stops, but with our one school bus making 10 stops a week. Our first year was 2012. We made 8 that year. We bumped it up to 9 the next year. This year we're up to 10. Between our first and our second years, we saw a 50% increase in our overall sales. We saw a 40% increase in the number of SNAP customers who came to us. We saw a 100% increase in the amount of money that our SNAP customers spent with us per transaction. It went from about $8 to about $16. And that was before the incentive. And 50% of our SNAP customers become regulars at the market. And I would defy any MBA to point to any business that's doing the same thing. So as I said, we're going up to 18 regular weekly market stops this season. There's a picture of the bus set up. We are a bunch of crazy hippies. And so we roll into these neighborhoods and set up a farmer's market. We're there for about 2 hours, and the folks come to us. Most of our outreach is done by word of mouth and by flyers. One thing about the population that we're serving, they're not wealthy, obviously. It's very hard to reach them. You can't do traditional advertising. We work with a lot of community organizations. This is one area, if I had to do something differently, I would like to invest more in this, but unfortunately, we need to put our resources sort of into that front line of making sure that we have the food and the staff to be out there and sell it. But what I want to talk to you about is our incentive program. So I'm sure most of you know how this works. Folks come to us with their EBT card. They spend $10 with us. We'll match it for $10 for fruits and vegetables. Innova and Wholesome Wave are 2 of our great partners that help fund that program. We raise funds from other groups as well. One of them is a private corporation called Power Supply. They do paleo meal catering, so they feel very strongly about clean proteins, so they are matching proteins as well. And our customers love it. So they're getting pastured eggs, grass-fed meat, organic milk, in addition to all their fruits and vegetables, and it makes a very big difference for them. They're going to be eating this stuff, and Power Supply feels like they should have access to the good stuff that everybody else has. Another one of the incentives that we're working with through Wholesome Wave is a veggie prescription program. There's a Unity Health Clinic that happens to be at one of the stops that we've already established in Ward 7, which is east of the Anacostia River. And that's where much of the poverty in Washington is concentrated. And so the Veggie RX program, folks will go to their doctor, I think once a week, for health counseling and some biometric feedback, measuring their weight and blood pressure and things like that, and they will get a voucher for a certain amount of money to come walk out the door, and there we will be with our mobile market, so they'll be able to exchange that. In order for healthy food to win the day, it needs to be the convenient choice. and it needs to be affordable, and it needs to be high quality. I can't tell you how many people in this city want to just say, well, just give the leftover stuff from the farmer's market to the poor people. They'll eat it. If you wouldn't eat it, they're not going to eat it. And what you have to understand is that the food industry, and forgive me, I think there might be some food industry people here, have hundreds of millions of dollars in marketing, and they have chemists who are making this food really desirable. I cannot stop eating cheese doodles. I love them. I can't have them in my house, but neither can anyone else. Salt, sugar, and fat, it makes you want to eat more. Combine that with shelf stability, omnipresence, and low price, and healthy food really doesn't have a prayer, unless it is convenient, it is well priced, it is made even better priced through incentives, and it is high quality. But the final piece is this. I saw recently a story in the New York, LA Times that was saying that, despite all these healthy corner stores, obesity hasn't changed at all, healthy food doesn't work, poor people don't want it. This is absolutely not the case. The missing piece with all of this is what people don't understand is that when folks have been living in neighborhoods without access to fresh, healthy ingredients, they don't know what to do with them. They don't know how to recognize them. They don't know how to keep them. And this stuff goes bad, and that is a significant disincentive when you have a very tight budget. So we have this woman who found us a couple of years ago. Her name is Juju Harris. She has begun referring to herself as the unicorn because she has suddenly gotten into very hot demand in Washington, D.C. She is African American, was in the Peace Corps, married a Paraguayan, speaks English and Spanish and this very small dialect from Paraguay. Her dad was a Tuskegee airman. She was a nanny for an Italian family and learned to cook and to feed this Italian family, and was a forest ranger. So she brings to, and was on SNAP and was on WIC, so she brings to Arcadia this incredible wealth of experience and an unbelievable ability to cook food very simply and beautifully and deliciously, and an instant rapport with our customers because she knows what they're up against. And over the winter, she collected the recipes that she prepares when we're out on the mobile market. And this is a critical piece of how we move food. And it all started as a marketing thing, and it's since turned into something else. But when we only buy food that is in season and in abundance, and the farmers that we buy from then therefore cut us a great deal. It's first quality, it hasn't been to the farmer's market, we pick it up directly from the farm, so that's how we keep the price down. But we were sitting on like this mother load of kale, and no one was buying it. So Juju made up this kale salad recipe that you'll see up there, and it's incredible. It's addictive. It's like green crack, and she started serving it. And people then would eat it, a little taste of it, walk away, turn around and come back and buy everything that they needed to make this salad. And so she's been doing that for 2 years, and we collected her recipes and some others, and we put them into this cookbook. And the intention was to publish this cookbook, pull together just enough money to get 800 copies so that we could give them to all of our regular SNAP, WIC, and FMNP customers. But NPR wrote about it, and we sold 1,500 copies. I only printed 1,000. 1,500 copies in 3 days, and it's kind of taken off. Juju's in Essence this month, and but the genius part of this is that we show the food at the farmer's market, and this was totally accidental. I'd love to take credit for it, but it's not. We show the food at the farmer's market so that people know what it is and what to do with it. There's a little bit of information. Here's what you do when you get home with it. Here are some easy ways for preparing it, and then 2 or 3 simple, delicious recipes. The piece that's missing from that LA Times article, from the Healthy Food Access programs around, is it's not that you build it and they will come. Our nation has a cultural problem with food. It's not just poor people. And so it's a re-education process, but it can't just be my plate, and it can't just be scolding and making people feel guilty. It has to be joyful and fun and all the reasons that we love food. And so that's what we're trying to do, is get people to see this not as healthy food that they should eat, but something delicious that makes them feel better, that is affordable, and knowing that they can come and get it from us every single week. So thank you for your time. I hope I answered all of the questions. And I have 4 or 5 cookbooks if you guys want to buy them.
wrong way here. Here I am. Hi, Martin Bork, Ecology Center. I wanted to start by thanking folks for bringing the Ecology Center and our farmer-focused approach to the healthy food incentives lineup today. I'll start with some background, jump into some project details, and finish up with some perspective on why we've taken a farm-focused approach. The Ecology Center was founded in 1969 in the run-up to the first Earth Day. Our mission is to inspire and build a sustainable, healthy, and just future for the East Bay, California, and beyond. We transform the ideals of sustainability into everyday practice. We deliver information you can act on, infrastructure you can count on, and leadership for lasting change. Starting with the nation's first curbside recycling program that we still operate, we're very hands-on, and we link nuts and bolts operations with public policy. We cover the major areas of urban environmental impact, waste and consumerism, energy and water conservation, toxics, transportation, climate change, and of course, food. We've been running farmers markets for over 25 years and have pioneered many advances in this field. Today, our food and farming division runs 3 weekly farmers markets, youth-run community food justice produce stands. We lead the California Alliance of Farmers Markets and host the Berkeley Food Policy Council, among other things. This division also offers statewide farmers market equity and access programming, like pioneering EBT access in California and helping over 250 markets in the state adopt this system. I tell you all of this to give you some orientation and background regarding our approach to Market Match, our Healthy Food Incentives program. I want to mention that the program manager and leader of this program is Carly Brinkman. She's here. She's here, and she'll be taking part in one of the afternoon panels. So Market Match is a growing consortium of 19 partners offering healthy food incentives in 20 counties at 150 farmers markets this year in California. Market Match seeks to solve the following fundamental public policy issue. Fresh, healthful, nutrient-dense produce costs significantly more than low-nutrient, high-calorie processed food. We all know this. If we do nothing, price is a barrier for those most at risk for diet-related health problems, and the public pays the devastating medical, economic, and social costs. If we drive down prices for sustainable family farmers, then the farmers, workers, and the environment pays the price. Left to market forces, this is an either-or solution, and in the end, the public pays dearly. So Market Match uses small incentives to match federal food benefits to overcome this conundrum, bringing more income to farmers and healthier purchasing to low-income shoppers. By putting federal benefits to double duty, both shoppers and farmers benefit at no additional cost to the public. So for the program basics, there's a handout that I believe was circulated. I'll walk you through it quickly, and the slide will help a little bit. Program was started in 2010 by Roots of Change. It's led by the Ecology Center at this point. It involves, as I said, 19 organizations in 20 counties. The beneficiaries are SNAP at all of the markets, SNAP recipients at all the markets, but also at some markets, WIC and senior benefits, FMNP, WIC, fruit and veggie coupons, SSI, SDI. So there's a whole spectrum of beneficiaries that go from 0 to 100 years in age. And the incentive level is also highly flexible. There may be a dollar for dollar match, 2 for 1, 40 cents to the dollar, 50 cents to the dollar, and the cap on the incentive, on the benefit is also pretty variable. So I think one of the characteristics of Market Match is that it is highly localized and reflects the local organizations and communities that have started it and that run it. The marketing and outreach for the program is both local and statewide, so there's a statewide brand and promotional materials and website and all that thing that run across that all the partners use, but also partners use their own local marketing and promotion for the program. The season is also highly variable and dependent on funding, so it may be a very short season from 2 months to running year-round. You can see our growth from 2010 to 2014. We've gone to 150 markets, almost 1,000 farmers served, nearly 40,000 shoppers, and about $1.5 million in total sales for 2013 through the program. We do annual surveying and impact evaluations that drive these charts. Our customer surveys and farmer surveys have shown some important things. The surveys show that farmers sell more fruits and vegetables, make more money, and get more shoppers as a result of the program. This drives real money to some of the nation's most economically devastated rural communities where unemployment can top 30%. Fully 18% of the 100+ farmers surveyed reported increasing their acreage to respond to market match demand. Shoppers report coming to market specifically for the incentive, buying more and a broader diversity of fresh produce. So with relatively small amounts of incentives, the program can drive significant numbers of shoppers and their federally subsidized purchasing into healthier choices that also support farming communities. The program's simple to administer, uses scrip at a central point of sale. You can see the tokens here, but some markets use a paper scrip. That's redeemed by shoppers with the farmers at eligible farm stands. And then those farmers redeem those with the program administrators, usually at the end of market day. Wanted to share with you a tool that we use to help people find markets in California. It's called the Farmers Market Finder. You can find it at fmfinder.org. And I'll show you a brief little video on how it works. But it's a website. It has all 850 farmers markets across the state of California on it. It has all the information about them. You can search it. We're just typing in our address at the Ecology Center here in Berkeley, California. You can see all the farmers markets. You get a list of the ones closest to you, and there's a link for directions, even on public transit. There's blue pins and green pins and orange pins. The orange pins are regular farmers market, or green pins have market match incentives. The blue pins accept EBT. You can filter by those. Green pins are the market match incentive markets. You can see them. There's 150 across the state. And you can filter by day of the week and location. And it's just a tool that we've developed so that local markets can help promote the program and that shoppers can find a market near them on the day of the week that they're interested in shopping. Our intention is to turn all those orange dots blue, meaning to get every market in the state to accept SNAP. And I'll go into why in just a minute. And we believe that even with the limited reach that farmers markets can provide in the SNAP marketplace, we can move overall SNAP consumer behavior in ways similar to the ways that farmers markets have helped to do that for the marketplace overall. It's a good place to note that in most states, if you say local food system, you're usually talking about the trend to rebuilding a marketplace for fresh, healthy foods produced by small regional family farmers. This is not the case in California. In California, industrial-scale agribusiness and transnational packing and distribution companies and large retail chains control the fruit and vegetable production for the whole country. So fresh and local does not mean small, sustainable, or family-run in California. In this system, 95 cents of every food dollar never make it back to farming communities, and most of the retail dollar never develops the local economy where it's spent. This is why focusing on farmers markets in California is critical to producing economic development, both for urban and rural communities. farmers markets keep those dollars directly in the hands of farmers and circulating in the local community. Oh, sorry. Okay. I'll just quickly, I just want to show you here. This is 16 years of SNAP redemption at Pacific Coast Farmers Market Association. You can see the gap where SNAP went to, from paper to electronic, and then the incentive, the impact of the incentive programs, which has increased their revenues in SNAP $50,000 per year, year over year for the last 5 years. I'll just quickly, in summary, state that Market Match is a growing statewide collaboration. It's trying to solve one of the fundamental problems of our time, which is that we have the cheapest and the most costly food system ever known to humankind. We're suffering, it's cheapest because we're paying less of our income for food than ever before, and most costly because we're paying more for diet-related illnesses than ever before. This is not sustainable, not healthy, and not just. Market Match uses public investment through federal SNAP and other benefits to support both low-income shoppers and family farmers. And direct marketing is critical to their survival. Together, we can provide a sustainable, healthy, and just future. Thank you.
Hi, I'm Nadia. I work for the Community Food Bank of Southern Arizona. I think I might be the only food bank representative here today. And like Alan mentioned, we are pretty unique in that we have an entire food resource center at the food bank that focuses on food security. The farmers markets are one of 7 programs that include farm to child, child nutrition, home garden cooperative, demonstration garden. There's more. But I'm here to talk about our farmers market and our consignment program. And so why? Why do we have farmers markets at a food bank, especially? Well, our clients are not doing so great. This was a client survey we did at the beginning of this year. These are the preliminary studies, and you can see the diet-related disease and illness is just rampant. We give out 1 emergency food box to our clients a month right now. It was 2 until the demand became too much. Within the last 4 years, our clients have doubled. So the line is just getting longer for the food boxes. It's not getting shorter. What's our answer? Farmers markets. Incentive programs, helping increase the access for these folks to get the healthy, fresh, nutrient-rich local food. And on the other hand, we have our local agriculture and our local farmers that aren't getting any money for the food that we're growing. I think that's pretty staggering. 95% of the food we grow in Arizona leaves the state. 97% of the food we eat, we import. It's just a huge disconnect. So again, if we spent $5 per person a week on local food, we keep $287 million in our local economy, and this supports then our vendors, our consignment members, which I'll explain in a moment what that is. So our farmers market program is really, like a lot of other folks, trying to bridge this gap. And because we are a food bank, and we're really good at being a food bank, and we have the social capital and the backing and the support of our community, we're able to be one of the only completely farmer, locally sourced farmers markets in Southern Arizona. We have a consignment program, a colleague of mine has helped pioneer, where we take any amount of food that anybody might grow in their backyard, small scale, small farmers who don't have the capacity to sell at a market every week or only grow certain seasons, certain times of the year. We take their food for them and we sell it for them. They keep 90%, we keep 10% for our program costs. Same with our vendors, incidentally. Because we're a food bank, we're able to support our small farms in that way at our farmers market. We run 1 true farmers market a week with anywhere from 20 to 30 vendors, all the small farms, completely, again, locally sourced. All the value added, all the food, salsas, anything that's made is made locally, small business owners. And then we set up our consignment table. Now the big piece of that, again, is the incentives, because we're one of the only farmers markets in southern Arizona that accepts the AZFMMP checks, that accepts SNAP. And like Pam was saying, we also do a lot of the informal education at the markets, at our farm stands. We were setting up a small mobile farm stand outside of the health center in Marana for a while. Marana is a very rural town north of Tucson. It's a food desert. There's no local food to be found within miles. So we drive our truck 20 miles out there, set up our fresh food. A woman comes downstairs from her doctor's office appointment and says, all right, my doctor just told me my diabetes is out of control. I have to do something about it now. I have to start eating healthy. I don't know what any of this is. What is this stuff that's on your table? What's that green stuff? You know, I've learned so much in the 2 years I've been at the market on how to cook this stuff myself, and so a lot of what we do, our volunteers, all of our programs, is we told her how to store it, how to chop it up and stick it in her eggs and hide it in her kids' lunch, you know, her sandwiches and stuff, and send her on her way. This is a constant thing. So 3 weeks later, she comes back from her next doctor's appointment and she says, you guys, I lost 10 pounds. My diabetes, I'm getting them under control, and my kids, they don't even know it. I'm putting kale in all their food and they don't know, and I love it. So it's a huge piece, is not only the access and not only supporting our growers, but teaching people how to use the food that we do have. In the desert, you see in the Building Social Capital, the Desert Harvest Series, I do outreach and I coordinate a lot of the events and stuff for the markets. And we have a Desert Harvest Series where we're teaching folks how to eat and harvest the native foods in our area. So mesquite pods, we set up a mill once a year. People can bring their pods and mill their mesquite flour. Mesquite flour is really good for folks with diabetes. It really helps your glycemic index. Nopales, the cactus, those are in season right now. People don't realize that there's only a short time of the year where they're tender and you can actually eat them and they're soft. And how do I even cook that? Well, we teach that. We have a workshop, we just had it on nopales. So we do that with all the native foods all year long at our big farmers market. And all of our markets except the AZFMMP, the senior checks. Hands down, we could not do what we do and provide the education and the access without these incentive programs. We also did do a SNAP matching program at the end of a CPVW grant, a big grant I'm sure some of you have heard of. And it was, you know, it's a no-brainer, of course. We match SNAP $10 to $20, and everyone wins. We had more SNAP usage, we had more sales revenue went up for our vendors, more new customers, and then when they come, one of our huge goals is bringing them into the community, getting back to their roots. Have you ever heard of verdolagas? Purslane in English? Well, it's it's not a weed, but it's a weed. It just grows in the washes right around the monsoon season coming up. And it's super trendy. I heard they're selling it for like $25 a pound in New York or something, but it's like a weed that, it's really tasty, kind of tangy, looks a little like spinach. You cook it like spinach, but it has the highest omega-3s of any plant. Almost matches fish for the omega-3s. And my grandmother my dad, when I told him we had it, he's like, oh man, my grandma used to make that for me all the time. And all of the folks who come and use their farmers market vouchers and their food stamps see that and they get so excited. Even folks my age or younger are like, oh yeah, my grandma made me that once. That's so cool. I'm gonna bring her back, you know? So it's a whole big picture that we're dealing with here. And a lesson learned, we've said it time and again in each of our own ways. Equity, how do we meet the needs of those people who don't have the means to make the healthy choices? How do we help educate them and empower them to make those healthy choices? Well, the farmers market program is one great way. These incentive programs that allow folks to be able to have that access is another one. That woman right there, she's the consignor, she's dropping off, that's all stuff she grew. And this statistic, a third of the people, our consignment program right now is at 180 people, which means at any given day, any market, we set it up so they can drop off their food right before a market. They typically harvest it that morning, so it's the most fresh, absolute delicious produce you could ever find. So, 1/3 of those folks rely on that money to survive. And half of them want to start their own small businesses. This is another challenge. I don't have it up there, but commercial kitchen space is a huge problem. I don't know, those of us who do work with people who grow their own food and want to add value to that food and sell it, have to go through all the regulations of the health department, have to cook it in a certified kitchen. There's maybe 3 in Tucson right now. And a big piece of what we do at the farmers market, we're thinking about changing our name to a food hub, because we don't just run our 3 markets a week. We connect people to these resources. We educate people. Hopefully we're empowering them to make these choices and connect back to real food. And yeah, I'm really proud of the fact that on average food travels less than 20 miles to get to our markets. There's that quote kind of says it all, you know, local organic foods not exclusively being made available to folks with money. Food justice is awesome, and it is these incentive programs that allow it to happen. So, thank you very much.
Good morning. Let's see. So in the immortal words of Monty Python, and now for something completely different. So my name's Danielle, and thank you for including me in this panel, because really it's not that different. I'm going to talk this morning about the Healthy Incentives Pilot, and I'll actually be talking again later about the impact and evaluation, so I won't be speaking to that now. But as they've described, there is a lot of incentive activity happening at farmers markets, and many of these efforts dovetail with SNAP to boost the buying power of low-income households at the markets. The Healthy Incentives Pilot also did operate at farmers markets, and significant effort went into developing 3 different mechanisms to make it work there. And I'll talk a little bit more about those as well. But as most of you likely know, HIP also and predominantly operated in retail settings at point of purchase. The why, to speak to that for us at FNS, is fairly straightforward. The Farm Bill, the Food Conservation Energy Act of 2008, authorized funds for pilot projects to determine if providing financial incentives to SNAP recipients at the point of sale would increase their consumption of fruits, vegetables, or other healthful foods. So the HIP model was developed out of that. The goal of the Healthy, and I'm sorry, I'm just gonna call it HIP. That's what I'm used to calling it. That's what we all call it, HIP. So the goal of HIP was to identify and test strategies to encourage healthier food purchases and healthier diets among SNAP participants. And to do this, we designed a system that would provide incentives at the point of purchase to encourage households participating in SNAP to increase their purchase and consumption of these items. The legislation, of course, also required that the pilot be rigorously evaluated. And this requirement did shape certain features of the pilot, and I'll speak to that this morning. So the nuts and bolts, the background on where HIP took place and how it worked. It operated in Hampden County, Massachusetts, a county in the western part of the state that has the lowest median income, highest poverty, obesity rates. In order to support the rigorous evaluation, it was a random assignment. So 7,500 of the approximately 55,000 SNAP participants in the county were randomly assigned to be HIP participants and to be able to earn the incentive. The pilot began, it was fully operational on November 1st, 2011, and the participants started they were in 3 waves. So the first wave began that month, and then they were phased in over 3 months, so that after having an opportunity to earn the incentive for 12 months, they would then go off, and then the pilot fully ended at the end of 2012. The incentive itself was a 30-cent incentive for every dollar in SNAP benefits spent. And so the benefits spent needed to be on these targeted fruits and vegetables and at participating retailers so that the incentive could be processed through the EBT swipe. The targeted fruits and vegetables included fresh, frozen, canned, or dried fruits and vegetables without added sugars, fats, or oils. They excluded fruit juice and white potatoes, and so they followed the existing set of the WIC fruit and vegetable cash value voucher, and that served to provide some consistency both to the consumers, to the customers, so that they could have an easier grasp perhaps of what counted, and to retailers, so they already were used to identifying that set of products. let's see. So while I can speak more clearly and obviously to why FNS pursued this pilot, we couldn't have done it alone, and there were so many partners involved in making HIP functional on the ground and enabling it to operate. And I can't necessarily speak to why each of them participated, but I can speak to the roles that they played in making it possible. The Massachusetts Department of Transitional Assistance they received the grant, and it was a competitively awarded grant for them to operate HIP. And they hired a project director, Frank Martinez-Nochito, who did a fabulous job working with a few dedicated staff members under an extremely restricted time frame to get HIP up and running in time to support the evaluation and to happen within the confines of the funding stream. They worked with, as it notes there, 75, potentially more community organizations, community partners, and they included local and regional nonprofits, they included medical centers, religious organizations, libraries, higher education institutions, a whole range of community organizations that were committed much in the same way that everyone's describing here this morning to supporting the local community and making healthy food more accessible. And they helped out in various ways, but primarily through client support and communication and outreach. They hosted the trainings that were made available to participants, and they helped translate materials as well. DTA also worked to recruit retailers because, of course, the way that HIP worked at the point of purchase required the willing participation of retailers to make all of these systems changes to their transaction system. Retailer recruitment was a long process, required a lot of work, and every effort was made to recruit as many retailers as possible across the county, across all retail types, and in part to test it in all settings, and in part to make sure that everyone who participated had access to a retailer where they could earn these incentives. In the end, over 100 retailers participated out of the 472 eligible in the county. A number of the large supermarkets and superstores did participate, though not all, and many of the smaller groceries as well as convenience stores participated. Now, while some of the chain retailers were eager to participate, others felt basically just unable to implement the nature of the systems changes in the time frame allotted. So part of that lack of participation among some of them, I think, would have gone otherwise if there was more time, frankly. To recruit the independent retailers, DTA ended up hiring a retailer liaison because they quickly realized that there needed to be a personal connection, that someone needed to go visit the stores and explain to them how HIP would work, what kinds of changes would be needed, and to encourage their participation. And that proved to be much more effective and did bring the retailers on board. In order to put all of these systems changes in place so that the incentive could be processed with the EBT swipe and be immediately credited into someone's EBT account, into their SNAP account, we needed to work closely with the EBT processor for the state, and that was Xerox. And so DTA worked with Xerox, who also worked closely with third-party processors and the retail software system producers to design the requirements that could process the HIP incentive. DTA, FNS, and the evaluation contractor as well, Apt Associates, participated in this process. DTA worked to coordinate the effort, and FNS provided the oversight and conducted the testing to make sure that once the changes were made, that everything still worked properly for our purposes. And Apt, the evaluation contractor, attended the meetings to make sure that they were aware of the process and to contribute to discussions to make sure that the systems changes would also support the data collection needs for the evaluation. It was also important for the evaluation contractor to be a part of the process, to be aware of any implementation issues that could impact the effects that we would observe on the participants, and to understand what might be going on. And in fact, what turned out to be the case was that many of the data needs that we put in initially thinking that it would be needed for the evaluation, it also helped DTA to identify problems that were occurring that they might not have noticed otherwise. And of course, communication with SNAP clients was critical to the pilot's success. They needed to be aware of the opportunity that they were given to earn these incentives. They needed to understand how it worked in order for it to impact their behavior. DTA offered trainings, but they were unfortunately poorly attended. And so most of the communication to SNAP clients happened really through direct mail. And that was in large part because of this random assignment within a site. And so that did pose certain challenges and limitations in terms of our ability to get the word out and fully communicate and fully ensure that everyone understood what products were eligible, what retailers were participating, and so on. But you couldn't do a full blanket public outreach effort because you couldn't contaminate the control population in that site. So I've listed here some of the things that are really program-related changes, things that happened to make HIP work that could be used. Now we know they work, basically. Now we know that we can effectively integrate a SNAP EBT transaction that can process at the point of purchase an incentive based on the items and the amount that they've spent on eligible items. The retailers and the EBT systems have gone through the process of designing and implementing those changes. We also developed 3 different models for farmers markets, and that's one of them there. So 2 electronic models to process both HIP and SNAP at farmers markets. But as I've already discussed a little bit, there were certainly these pilot-specific features that were necessary because of either the time constraints or the evaluation demands that were only needed because of the fact that it was a pilot. And so to wrap up, I can't really speak necessarily to what we would do differently, but I just wanted to call attention to a few things that if someone wanted to do something like HIP, is still left open for thinking about. And I'll talk about, like I said, the impact evaluation later. But in terms of doing it elsewhere, talked about the client outreach and promotion, those limitations would be gone if you're not doing the same kind of evaluation. Retailer recruitment strategies, what products, I think that it was wise to stick with a product selection that was consistent with another category. I think that reduces some complexities. And in many ways, the incentive amount itself is still an open research question. As I'll describe later today, the incentive amount proved to be effective on encouraging healthier eating. But we don't know if 30 cents on the dollar is optimal, or if it's higher than it needs to be, if a higher amount would have similarly higher impacts. So those are open questions for further research.